Transcription on Covid-19. The city of Wuhan in China was the one that first reported the case of Covid-19 in December 2019. Further, the World Health Organization declared the outbreak of this disease as a pandemic in March 2020. Due to this outbreak, a lot of countries all over the world announced a nationwide lockdown. This was done as a preventive measure against the pandemic. Ultimately, it limited the movement of billions of people all over the world. Consequently, all commercial establishments, including schools and colleges, were shut down. In addition to this, international and intra-state travel also saw a ban. Similarly, many of the countries suspended tourist visas to avoid the outbreak of this disease. In countries like India, people from underprivileged backgrounds had to suffer greatly. Even to date, many have not been able to earn a proper livelihood. Shortage of food, loss of income, and more have become a common phenomenon for some. Similarly, industries like pharmaceuticals, tourism, the power sector, and more are also suffering losses after the coronavirus outbreak. All in all, it has an impact on the global economy as well as our daily lives. Coronavirus and coronavirus symptoms are something everyone is looking for. As per the CDC, you may have coronavirus if you are experiencing symptoms like fever, cough, difficulty in breathing, fatigue, headache, body ache, new loss of smell or taste, congestion, diarrhea, sore throat, runny nose, etc. Other than that, there are additional symptoms that may possibly happen to anyone. It depends on the individual. Further, the symptoms will start appearing between 2 to 14 days after you have been exposed to the virus. In children, symptoms can be milder when we compare them to adults. On the other hand, people who have serious underlying conditions such as heart disease or diabetics and older people will be at a greater risk of complications. One must immediately get medical attention if one is having trouble breathing. Other warning signs include persistent pain or pressure in the chest. Further, if one cannot seem to wake up from their sleep or their lips or face start to turn blue, they must get medical attention instantly. Therefore, governments and health organizations all over the world are consistently working to limit the outbreak of coronavirus and coronavirus symptoms. Similarly, our healthcare professionals are facing various difficulties to protect others' lives. We must work together as one and be responsible on our part to safeguard our lives as well as others. The COVID-19 pandemic has led to a dramatic loss of human life worldwide and presents an unprecedented challenge to public health, food systems, and the world of work. The economic and the social disruption caused by the pandemic is devastating. Millions of the enterprises face an factual threat. Without the means to earn an income during lockdowns, many are unable to feed themselves and their families. For most, no income means no food or at best less food and less nutritious food. In India, the first case of COVID-19 infection was reported on 30 January 2020. Soon afterwards, the government of India took preventive measures starting with progressive tightening of international travel, the issuing of advisories, quarantine facilities, contact tracing, social distancing, etc. After the countrywide Janta curfew on March 2020, the Prime Minister of India announced a nationwide lockdown on 24 March for 21 days. The lockdowns were periodically extended till 31st March 2020 and thereafter restrictions were lifted in phases until the later part of the year. The Government of India announced a relief package to the tune of rupees 1700 billion for the poor. The Taxation and Other Laws Ordinance 2020 was promulgated on 31st March 2020 to provide an extension of time limits and the waivers of penalties. Steps like relief to borrowers in repayment of loans and short-term credit to Indian states were also taken by the Reserve Bank of India. The Prime Minister's Citizen Assistance and Relief in Emergency Situations Fund, also called PM Cares Fund, was instituted. The government decided to put the Members of Parliament Local Area Development Scheme on hold for 2 years from 2020 to 21 to 2021 to 22. The Parliament of India actively supported the Government of India's efforts to fight the COVID-19 pandemic. Our Parliament's capacity to continue functioning during the pandemic testifies the strength and durability of our democratic system. Taking early preventive measures on 17 March 2020, PM convened a meeting of senior officials of various agencies to review the situation on the ground, and measures were taken in the Parliament, House, Estate and the surrounding areas. The budget session of Parliament was concluded on 23 March 2020, nearly 2 weeks ahead of the scheduled time after a consensus across party lines. On 16 January 2021, the Prime Minister launched the world's largest vaccination campaign with 2 Made in India vaccines, Covishield and Covaxin. India has also used its vaccine production and delivery capacity to help humanity. To complement the efforts of the government, some important initiatives were taken by the Parliament of India. An amendment was made to the salary, allowances and pension of Members of Parliament Act 1954, which provided for a 30% reduction in the salary of Members of Parliament for a period of 1 year. Officers and staff of the Lok Sabha Secretariat also contributed 1 day's salary amounting to approximately Rs 4.5 million to the PM Cares Fund. Now is the time for people all across the world to stand up and help those in need, especially those in developing and growing economies. It is possible to end the coronavirus epidemic if all countries work together. COVID-19 must be eradicated worldwide, so international cooperation is very crucial. If the virus is allowed to persist in any country, it will eventually spread to the rest of the world. Therefore, cooperation is crucial if we are to achieve a complete victory over the COVID-19. Furthermore, we need to create long-term sustainable policies to deal with the problems plaguing the health sector worldwide.